So hello to all the viewers. With me, I have Dr. Sachin Krishna Raj, who has secured rank 3 in the NEET SS medical group exam. So Sachin, hearty congratulations on your achievement.
Thank you. Thank you so much.
Okay. So I'm excited to have Sachin with me, primarily for one reason. He did MD medicine from Government Medical College, Calicut, where I also did my MD from. Such a beautiful place. It is almost the food capital of Kerala. So Sachin, so how was the journey in Calicut Medical College for your MD?
It was very good, sir. Like I enjoyed the 3 years, the place, the people, and the college. Everything is was very good.
Yeah, because when you used to do MD, usually when you do MD medicine in any college, you are likely to put down weight. But in Calicut, you're likely to put up weight.
Yes.
I still remember in Calicut, the juice shop, that Naradandi juice shop you had just outside the college gate.
Yes.
Every day, I used to have 2 or 3. Okay, so yeah, so all right. So nice to have you here. So Sachin, first of all, rank 3 in such a a competitive exam is a big achievement. All credits to your effort that you have put in, and also the training that you have got from Calicut Medical College. I'm sure that is the prime reason. Now, just to ask you a few questions. First of all, many of the subsequent students who are planning to write the exam will want to know from you about the pattern of the exam. So can you just brief them on how was the first ever NEET SS medical group exam, the level of toughness, was it more factual, clinical, what percentage of questions from Harrison? So just brief on the exam pattern.
Yes, sir. I think the exam was primarily Harrison based. I felt that majority, more than 75% questions were, I think, directly taken from Harrison. Many were straight lines picked up from Harrison in the options. Okay. So anyone who reads Harrison properly will have a very good chance, I felt. And I felt this exam was more on the factual side. Like they asked many of the syndromes and many things which we usually expect more in the NEET PG level. Such type of questions were slightly on the higher side on this examination is what I felt. Okay. It was, I think, a moderate to difficult level of paper, I can tell, because even though the questions seemed simple, but the options were very close by. So it was kind of difficult to eliminate the options and get the correct answer.
Okay. All right. So
that was what I felt.
Yeah, even when I was doing just a while back interview of rank 48, Arjun, he happens to be from Trivandrum Medical College, and also rank 58, our student from Maulana Asad Medical College. So both of them said the same point that you said, that the question was similar to that of a NEET PG, in terms that, there were good number of, say, factual questions. Yes, there were some clinical questions also, but it was slightly more filtered towards the factual side, slightly. So Sachin, just tell us, seeing the first 20 questions on the exam day, did you get the idea that, okay, this paper is likely to be factual, or were you prepared, okay, this could be anything, either factual or clinical?
Actually, I expected the paper to be more of clinical, sir, because many mock tests which I had given, everything expected pattern, even last year's questions were all mainly clinical based. So I felt that the exam would be more of long questions, because there were 150 minutes for 150 questions. Okay. But after some 20 to 30 questions in the paper, I realized that it is more of fact based, more of one-liners rather than case-based scenarios. There were cases, but even then, those were mainly for regarding one-liners type of questions.
Okay. And did you feel that any particular subjects were given more importance, any areas, any such sort of comments?
I felt that cardio and neuro, there were a comparatively more number of questions than the smaller subjects. Correct. Hemat and oncology, I don't think many questions were asked.
Onco, I think just cardio, on hepatocellular carcinoma came from onco, and obviously some questions from the hematological malignancies part.
Yeah. Those were very basic questions from the hematology side was asked. I think more ECG based questions, where many ECG questions were there.
Okay.
And many like cardiology and many genetic questions was actually, I don't think it was like as much as expect, like much more than expected.
Okay.
Many syndromes were there, which some of them I have never heard of.
Okay. All right. So see, how many questions did you attempt during the exam?
I attempted all.
So I think even rank 1 also attempted all questions. And just for the viewers, approximately how many questions do you think you got it right? Approximately.
I got 500 marks. So I should have got, I think, 18 wrong. No, 20 wrong. So 130.
130. Okay. So did you have a look at the possible answers after coming back? And did you actually have a similar score in mind? 130?
Like kind of similar score was
Okay.
like I thought I will get around 120 to 130 probably.
Okay.
Because like the answers were also little confusing because the recalls usually are not 100% accurate also.
Yeah. All right. And coming to the DocTutorials part, I think you have written exams of DocTutorials.
Yes.
So you have written the grand test, and also can you just tell us what were the approximate ranks that you got in the grand test of DocTutorials?
I used to get in the top 10 usually.
Okay.
Like most of the grand tests I wrote got in the top 10.
So almost consistently you were in the top 10, right?
Yes.
Okay. So how were the questions of the grand test, and did writing grand test with a good number of students just give you an idea, okay, I am actually doing reasonably well amongst a good lot of students?
Yeah, actually the grand tests were actually very helpful, sir, because they covered like majority of the portions, and like each grand test, all the subjects were covered in like equal distribution, and it was like a very good revision, and it helped us like know where we stand also, because I think almost everyone, like many people wrote the grand test, and it gave us a very rough idea as to where we stand. And like each grand, the questions were of almost similar pattern to like what we got.
Okay.
The level of the questions were very similar.
Okay. So out of the 150 questions in those grand tests that you wrote, you said your ranks were in top 10. Approximately how many questions you got right at that time? Number of correct.
I used to get around 110 to 120 rates.
120, right? Okay. So how important is practicing MCQs? Because I've seen many candidates aspiring for NEET tests, reading a lot, but because of the vastness of the subject, they keep on reading, but somehow they do not practice questions. So what is your take on practicing
I
MCQs?
feel that actually practicing MCQs is much more important than like a lot of time, like reading a lot of times, because when we do some error in the MCQs, or when something goes wrong, then it tends to like we tend to remember it much more than like how like even if we do some 3 to 4 revisions, if we do one error, I think the one error will remain in our memory more than the 3 to 4 readings.
Okay. So that again reinforces the importance of writing the grand test MCQs and all. So on the exam day, after giving the exam, Sachin, were you expecting rank 3 or maybe a rank under 10?
No, sir, like after the exam, like I felt it was a slightly tougher paper, because
Okay.
there were many questions, like many options, which I had no clue about, many syndromes.
Okay.
So I was not actually expecting, but
Okay.
after I saw the recalls and all, like I felt maybe.
Okay. All right. Okay. All right. So with the rank 3, have you decided on which subject you want to take, or you are still having a bit of dilemma?
No, like I am still confused, and I have not yet decided. Still thinking about it, like what branch to take.
Okay. Okay. All right. But anyway, you've got such a good rank. I think, you can choose probably any branch that you want. And what is the message that you want to convey to your teachers in Calicut Medical College, Medicine Department?
Like the department is like very good, like whatever the exposure we get, our teachers, like they are very good and very helpful and always with us, and whatever they do during PG should actually be very helpful for even these exams, because whatever cases we get is what we remember more than what we actually read. That is what I felt.
That is absolutely right, because see, even when I did MD in Calicut, the diversity of cases that you get in Calicut, and also the people there also, I think,
Yes.
it's a wonderful place to work. You might have noticed that, right?
Yes.
So yeah, so thanks a lot, Sachin, for joining,
Thank you.
and all the best. And
Thank you.
so just think on which branch you want to choose, And I'm sure that you will be able to narrow down to one branch. And all the best for your professional and personal life. Thank you so much.
Thank you, sir.